We've already started the strategy to make sure we target those vulnerable communities the most. And when any of us see any person over the age of 70 in particular who isn't vaccinated, that is a huge concern. I'm 50, I've had AstraZeneca. There is no reason for anybody not to accept either vaccine. And I just urge people who are older, the statistics are the best source of truth. The statistics tell us that if you're double dose vaccinated, the chances of you getting into hospital or intensive care are much, much lower. But obviously those risks increase the older you are, whether you have an illness, whether you have a comorbidity. And what we do, of course, when we report the tragic deaths from COVID, we say someone who died with COVID, but sometimes people have underlying conditions or very serious illness, and that's why we're completely transparent. But we appreciate how strongly and how well the vaccines work. But in particular, we don't want to see anybody vulnerable not take the vaccine, because anyone who's unvaccinated is exposed as much now as they will be when we start opening up. Well, obviously, the Commonwealth had responsibility for some of those priority groups, and we're addressing some of those challenges, as well as older Australians. But there is ample supply of AstraZeneca. So anybody should come forward and get vaccinated. We don't want to see anybody vulnerable without vaccine. Vaccines, I mean, this is, I've said a couple of times, really a pandemic and epidemic of the unvaccinated. When we do see people who are fully vaccinated hospitalised or horribly die, often there are other conditions associated with that. So let's be very clear. The evidence is quite stark. And I say to the other states, don't assume because you don't have cases today, you won't tomorrow or the day after. Get ready. Vaccinate your populations, get the intensive care capacity going as we've done, to make sure you can meet those challenges, because there is no way that Australia or parts of Australia will be COVID-free, especially once we hit those 70 and 80% double doses. Ursula hasn't asked one.
What motivated the decision to change the exercise rules in the LGAs, and what stopped you from going further, say removing the curfew?
Oh, certainly. Well, obviously we know that outdoor exercise, especially in those LGAs where they're households that are exercising, is very low risk of transmission. But obviously we ask people to make sure if you're coming into contact with other people, have your mask on to avoid that. And obviously health and wellbeing and mental health are very critical at this stage. And when our public health team gives us advice, government also needs to consider the broader health and wellbeing aspects, and it was a combination of health advice but also wellbeing. We want people to get fresh air, especially as the weather is warming up, and where we can, we want everybody in New South Wales to move forward together, and that's why I was very pleased to make that announcement. The other degree of confidence that it gives us is many of those local government areas of concern either have higher or close to 70% first dose. And that level of vaccine, whilst not foolproof because it's not double dose, it does give us some level of comfort that some proportion of the community is some way protected. So that is our thinking. As I've said, the most important figures that we're looking at on a day-to-day basis are the rate of vaccination and how many people regrettably have to be taken care of in intensive care. And they're the two numbers that we will continue to monitor on a daily basis. And obviously, as I said, serious illness tends to happen in the second week after someone's diagnosed, and that's why there's a lag, and that's why October is likely to be the worst month for the number of people, unfortunately, who die and the number of people that are in intensive care. And we're obviously continuing to address those issues. But as Dr Chan and Minister Hazzard have said on a number of occasions, our pandemic plans have been in place for 18 months. Do we need to do things differently? Of course we do. It's a pandemic. Will the health system cope? Of course it will. Will it be stretched? Of course it will. And does our heart and minds every day go to those healthcare workers for whom every day is a stretch and a challenge? Absolutely. Treating people with COVID is extremely difficult, let alone having COVID and let alone being a loved one who can't visit your loved one because of COVID. So these are challenges everybody is going through on a day-to-day basis. And as we say, we know it's not any secret that the best way for us to cope in relation to our health system, but also in relation to serious illness and death, is vaccination.
What about the 3-year-old boy who was stuck in Griffith Are you able to facilitate something with the Queensland Premier, get on the phone to her and ask her for some help?
Oh, look, it's always heartbreaking when we see so many examples every day, such as that one. And I just ask every state premier to, as we do in New South Wales, and Minister Hazzard on a daily basis is making exemptions every day for people who are in dire situations. And I just ask everyone to consider those cases, consider those exemptions, and also to have a compassionate approach, because we know that living during a pandemic is difficult enough, but when families are torn apart and when children are separated from parents, it's especially difficult.
Call the Queensland Premier and ask her.
Yeah. Okay, but regrettably, whilst that case has been highlighted, there are hundreds and hundreds of other cases like that. And I just want to put that on the record, that whilst we hear about these cases from time to time, there are hundreds and hundreds of cases like that every day. And that's why all of us, no matter which state we govern and what our circumstances are, all of us have to display a degree of compassion and understanding, because perfection in a pandemic can never be achieved.